because you're in the heart of the community through the COVID pandemic and in recent weeks, I'm really interested to know how, at pharmacy level, your staff, of how they really helped and supported the patients. I wonder if you've either got a specific example or a shout out for anyone in particular who has gone beyond, without putting you on the spot here.
Yeah, well, we all had the volunteers.
Yeah, exactly.
The volunteers were great, but the staff did over and above, cancelled all their holidays, were happy enough to keep working through their owed holidays or their owed time in lieu. That's something that we're going to have to meet in the second 6 months of the year, but we still don't know about the second spike. So we still have that sort of Damocles hanging over us. With regards to holding the hands of our patients and customers, and with a myriad of different health difficulties, possibilities, problems, we just saw them all and met them all at the dispensing bench and the counter, and whatever was needed, the answer was yes.
Yeah.
Because it's that we're the first and last port of call for the community, be it palliative care, where medicines were out of stock. We were driving around Liverpool pulling drugs from our other pharmacies, identifying people and helping the pharmacies that were running low in stocks or where the stock was difficult, where unusual prescribing was taking place.
And Yashar, have you had a very similar?
I think, to be honest, John's absolutely nailed the answer.
Hasn't he?
I mean, it's just really down about to being proud and giving the our customers access. We were the only face-to-face healthcare professional for quite a long period of time that was available, we championed that. What I'm proud of as a pharmacist is that I was there when our country needed us the most. The same about all of our staff; they can all say the same. The community, you can definitely see that there's a real movement towards a more understanding of what pharmacists and pharmacies do and what the community can get back from them. There's a lot of surveys that are going out now, whether that's run by the MPA or the PSNC or any other body, that are championing our voice back to the Department of Health and Government in terms of how much respect we've gained from what we've done during this really, really awful time. And it's really a dark way of putting it, but it caused something like COVID to actually make the government realise the value of pharmacy. And nobody ever wanted it to exist, but if we're going to take one positive, if there is anything you can take from the whole situation, is that we as a profession, pharmacy, have shown that when the NHS need us the most, we have been there, and no questions asked. We were walking into battle. That's what it felt like every morning when you're going in. Me and my team, is we were there. We were there for our community. We were there to support them in every which way. And John's obviously shared lots of stories about going over and beyond, whether it's nothing related to healthcare, it's just relating to other things entirely to help them through the COVID, the restrictions that are in place. Yeah, I'm certainly, as a positive note for me, is that I feel proud of everything that me and my team have done. I don't think there's any pharmacist that if you speak to them, would have any different opinion to what I do and what John has done. Is that we worked our socks off, and we will continue to do that, even if there's a second wave or not.